Some tragic news to share with you here this evening as former Nebraska Senator Ben Sasse announced today that he's been diagnosed with stage 4 pancreatic cancer. The 53-year-old announced the diagnosis on social media this morning, calling it a death sentence. He has 3 children, the youngest of whom is 14 years old. Sasse is now one of the roughly 65,000 Americans diagnosed with the disease every year. Reporter Katrina Markles talking with local cancer experts about this sad announcement.
On Tuesday, former Nebraska Senator Ben Sasse announced he has stage 4 pancreatic cancer. It's a tough cancer to treat and relatively uncommon. I learned that in someone Sasse's age, it's even less common. Dr. Kelsey Clutie, a cancer specialist from the Fred and Pamela Buffett Cancer Center, says typically pancreatic cancer patients are in their late 60s or early 70s. But doctors are seeing it more often in patients Sasse's age and even younger, and they don't know why.
Because it is scary to see young people getting diagnosed with this, at earlier and earlier ages.
Stage 4 cancer means that the cancer has spread to other organs, making it difficult to treat. Sasse called his diagnosis a death sentence in his social media post. Clutie says that's because pancreatic cancer is often discovered after it's spread.
This is tricky because oftentimes we see people who have been feeling totally fine. They have some belly pain, have a scan, and we have a tumor in the pancreas that's probably been there for, who knows, a couple of years.
The pancreas is an organ that regulates blood sugar and helps with digestion. Clutie says we can live without it, but by the time the cancer is discovered, it's often too late.
The other tricky thing is it doesn't tend to respond to treatments in the way that a lot of other types of cancer do.
She says there are several promising drug trials in progress, but the best treatment for most people with stage 4 pancreatic cancer right now is chemotherapy, which adds about a year of life for someone with a stage 4 diagnosis. Sasse indicated in his social media statement that he intends to pursue treatment. I'm neighborhood reporter Katrina Markles.
Now, this was the first that we'd heard from Sasse in a while, really keeping to himself since stepping down as University of Florida president back in July of 2024. Then he cited his wife's own health issues with epilepsy for his unexpected departure. Prior to becoming University of Florida president, Sasse served Nebraskans as a U.S. Senator from 2015 to 2023. He grew up in Fremont, received an Ivy League education, and served as president of Midland University in Fremont. The news of his diagnosis coming as an absolute shock today. Nebraska leaders have been reacting and sending him well wishes on social media, along with leaders across the country. Vice President J.D. Vance offered his condolences, and so did U.S. House Speaker Mike Johnson.